Good day and welcome to Lecture 5. In this lecture, we will look at 3 possible scenarios that nurses are mostly confronted with in their daily practice. These include how and if there should be a continuity in a patient's treatment, end-of-life decisions, and safety aspects in the practice as well as in the workplace. Ethical decision-making comprises of 3 approaches for scenarios. These include considerations for continuity, end-of-life decisions, and speaking up for safety. The first approach we will be discussing is considerations for continuity. This approach focuses on consideration for the continuity of care in relation to what the patient or group of patient currently needs versus the situation that they are in that moment. We need to explore the continuity of care by utilizing the application of ethical principles such as autonomy, beneficence, non-maleficence, distributive justice. Example, you are confronted with 2 patients. One patient requests a glass of water and the other needs your help first since the IVI bag is nearly complete. There's no denying the request for water, but you need to reflect on which patient needs the more continuity of care at that moment. The second approach is considerations for end-of-life decisions. It is important that end-of-life decisions are done with the family involved, and the application of shared ethical principles should be applied in such a situation. Here, there should be an analysis of the ethical and legal implications of such a decision. Example, in South Africa, discussions on do not resuscitate are done. The final approach is consideration for safety. I think staffing ratio is something we can all agree with. But before we agree, we need to consider the following questions. How real is the situation? What can we do as professional nurses to follow our institution's policy for staff ratios, staffing per shift, what to do when staff are not reporting on duty, and how can we, together with the management, resolve the situation? However, staffing ratio can be a challenge. The question that should be asked is the situation actually accurate? The need to identify whether there is a real or potential harm of the situation, and if so, who and what should be done to address it, is to ensure the safe care delivery. We have come to the end of our lecture. Thank you.